Hi, I'm Reed Holson. Welcome to Sioux Falls Directions, where we sit down and have conversations about what's going on in your city of Sioux Falls with Sioux Falls directors of the city and, of course, newsmakers and people that are providing services also for the city of Sioux Falls. This episode, we're talking about your EMS system. So when you have an emergency or you have something going on that needs immediate attention, you're used to calling 911, but how does all that system work? And of course, for the first time in many years, the City of Sioux Falls has a new partner in providing ambulance services. So we thought we'd bring in the experts and have a roundtable discussion on the EMS system in the City of Sioux Falls. Here today, Jill Franken, Public Health Director of the City of Sioux Falls. Paul Niedringhaus, 911 Director, Metro 911. And then, of course, we have Mike Bureau, who's the Chief Operating Officer of Paramedics Plus, our ambulance provider, and Fire Chief Jim Sideras. Welcome, everyone. We appreciate it very much.
Thank you.
To start us off, tell us what the EMS system is and how it works from your perspective and what you operate with. And we'll start with Paul.
All right. Well, it kind of starts with Metro Communications, and we're kind of behind the scenes. I think we're that phone call from the citizen, and when that phone call comes in, the dispatcher answers that phone call, and through a series of triage of questions, interrogation from our dispatcher to that caller, will determine how we dispatch that call to who. And depending on the call, police, fire, ambulance will be dispatched to that call. And that's kind of who we have here and who is involved in that emergency medical system that we have created. And that's in a nutshell kind of how it starts, is that caller to Metro Communications, and it kind of kicks off who we contact and at what priority level.
And Mike, how does that work for your organization?
Certainly. So it begins with, of course, the call is processed, and from there it's forwarded to the ambulance crews out inside the city, and then from there they go ahead and respond to the call. And once they arrive, they meet whatever that need is, and then transport that patient to the hospital. And that kind of closes that loop from first call to arrival at hospital.
I think it's interesting, too, that there's a difference in how your ambulances are dispatched, because we often see them parked around town. How does that work for efficiency?
Absolutely, I can answer that. So it's called System Status Management, and it's a philosophy on ambulance service that's based on putting your resources always in a position where they're able to respond and do the most good. And we decide that by looking at frequencies of calls over historical periods in the city, and creating heat maps, and then figuring out where those calls are, and then placing ambulances in positions where they're able to respond to those areas quickly.
And Jim, with the Sioux Falls Fire Rescue,
Sure.
You're often quite involved too, because oftentimes you're dispatched on an EMS call.
Right, most of our calls now are getting to be EMS. We're usually beat the ambulance there just because we have more stations around, and then our role is really that stabilize that patient, determine what's going on, those first life-saving skills, if it's defibrillation or depending on what's going on, if it's a trauma, stabilize the patient, get everything ready, get the patient ready, relay that information to the ambulance, and then we work seamlessly together to manage that patient and then move the patient to a hospital.
And Jill, Public Health, you kind of oversee this whole thing
Well,
in
do.
an interesting way.
Yeah, we do. Our purpose and work that we do is really threefold. It's making sure that the ambulance contract, all the compliance is being met. And then my team also assures that the quality of the EMS system is being met across the continuum of the system. And then we also, our team supports the REMSA board and the REMSA Medical Board, or Regional Emergency Medical Services Authority, help support the work they do to assure that through those citizens that the oversight and quality is being adhered to the degree that we want in our community.
And so what does REMSA stand for? Because we
Yep.
often hear that in the news all the
Yep,
time. What is that?
Regional Emergency Medical Services Authority. And so there's a 5-citizen board that makes up the REMSA board, and they're appointed by the mayor and approved by the city council. And then there's also a committee or a sub-board of that's the REMSA medical board, and that's made up of medical providers in our community, emergency physicians, family physicians, members of the teams that these folks represent, and they look at guidelines, protocols. They approve various pieces of the work that needs to be done to make sure that it's meeting the standards that we've agreed to.
And it's really multidisciplinary. That's a term that you use quite a bit too. Why are there so many people involved in this?
Well, this is a perfect example of that. It takes all of us sitting here this morning to really fully explain and help provide that picture of what an EMS system is. I think a lot of times folks think the EMS system is simply an ambulance coming and showing up, but they don't realize that a high-performing EMS system is really made up of many components, and those components have to work very well together and really be truly a system. So you can't separate them out and look at them as isolated pieces of the system, but really have to look at it as a whole.
Paul, when we call 911, how do you prioritize? Because if you haven't been to Metro 911 or taken the Citizens Academy, what you do is really comprehensive. So tell us about prioritizing calls and how all that works.
It really is. I mean, I think you hit it in the head when you said how comprehensive it really is. And we go through a series of questions, interrogation, if you will, to the caller to help determine how we prioritize that call. And we have outstanding staff. We are accredited agency through ACE, accreditation of Center of Excellence, and something that we're very proud of. So we follow a series of protocol questions that we ask. Through those questions and the answers that we get will determine what level we prioritize it, and then how we send it out to the fire, to the ambulance, and to the police. And there's 3 levels: priority 1, which is emergency, life-threatening; priority 2, not emergency, or emergency, not life-threatening; and then a non-emergency, priority 3 level. So through that protocol, through that triage of questions and the answers that we get will determine how we dispatch the appropriate medical services.
So the operators are trained to ask really in-depth questions to find out what the purpose of the call is.
They are. It's kind of, at the time, that caller may seem like, well, you're asking a lot of questions. Are you going to send the ambulance? Are you going to send the police and fire? But what we do at the same time as we're asking those questions, another dispatcher is actually in contact and communication over the radio, dispatching the services. So things that happen at the same time and getting those appropriate responses as fast as we can out to the community.
So Mike, with Paramedics Plus, then you're not deciding what the priority is. You're getting that from Metro.
Absolutely correct. The call comes in and we're assigned whether that's a priority 1, as Paul said, an emergent life threat, whether that's a priority 2. It's emergency, but it's not a life threat. It's a serious matter, but those extra couple seconds aren't really necessary that we see there. And then priority 3, which is non-emergency, but still coming through the 911 system. So that's no lights and no sirens. And we would love for every call to be a lights and sirens call, but unfortunately, driving emergency, whether that's fire, police, or EMS, is very dangerous for not only the responders, but the public. So we need to make sure that we're using the adequate call triage to get the right resource there at the right time as safely as possible for not only the community, but for the responders as well.
Jim, why is Sioux Falls Fire Rescue often on the scene too? A lot of our citizens will ask that question.
Sure.
It seems like an overabundance of response. There's obviously a reason for that.
Sure, all our firefighters are all EMT trained, so they can do those basic first skills that will keep people alive. When we look at someone in a cardiac arrest, every minute they're in a cardiac arrest, our survivability decreases by 10%. So if we can shock that patient quicker before the ambulance arrives, we increases the chance of survival for those patients. So, and then again, that's based on what the caller says. It's based on looking at the REMSA medical board, what they look at the protocols. But that's the reason is we can get medical help there even quicker at a basic level to stabilize that patient. So it's a real tiered approach.
Mm-hmm. Help us understand, Mike, this term level 0 that's been out as well too, understanding what that means in a response. So everybody just really gets what that means.
Okay, I can happily address that for you. Really what we're saying there is that resources are depleted. And so what that means is ambulances are currently involved in some form of call. That could be there at the hospital dropping off a patient. That could be at the moment that the call drops in, they're at the station restocking something. It doesn't mean that there's really any delay in them coming to your side. It just means at that moment there is not an available unit at post available to take that call. It doesn't mean they won't be available in 10 seconds. It doesn't mean that they can't choose to become available. And we were really using that term originally as a way to help us understand and to track where resources were, what turnaround times were at hospitals, Do we need to make changes to equipment so we can have less out of service hours? Things like that. It was really meant to be just a mechanism to help facilitate a communication that we're not having to post covered at that moment.
Yeah, and not necessarily a negative thing.
Absolutely.
It's just a point where you make different decisions on and using resources. So let's take that a step further and talk about mutual aid. You know, when are there times when we need help in providing EMS services, and what's the process that goes through with that?
Certainly. Well, I would begin with that and say that, you know, a mutual aid agreement can sometimes be informal. It can sometimes be informal. They're fairly common throughout the country, from small communities to large communities. And really what a mutual aid agreement means is that if you're in a position where your demand or your need in your community outweighs the resources you have available, other communities will help one another. You know, all across the country, people agree to these things. In terms of where we're at today with mutual aid agreements, I think Paul would be a great one to answer as we've kind of helped move that decision making over to his organization.
It's actually pretty simple. For mutual aid for us is we're looking for that next available closest unit that can respond. And a lot of times I think for mutual aid, the easiest way is when there's an incident that overwhelms somebody and more resources need to come in. Metro is kind of the manager to helps manage those resources. How can we best get another ambulance, another fire truck, a law enforcement patrol deputy to that scene? We look for that next available unit that's closest that can respond to that area. Mm-hmm. And in a sense, I think that's, for us, a good way to put what is mutual aid. Mm-hmm.
And it's just working together to decide what the best response at the right time is,
Right.
to make sure that you reach your goals.
And mutual aid isn't just, and we're talking about the ambulance, but we've been doing mutual aid with fire, just like ambulance for years with our surrounding community. So it's nothing new. We've always been doing it, and it works well through Metro, getting those resources that we need together. So it's not a new thing. It's been going on for years, I'd say, for years.
Mm-hmm.
I would say, though, that this team and this leadership group, though, has done an excellent job of really saying, when do we want to reserve mutual aid for? What is the true purpose? What do we want it to look like? And what do we want to limit it to? And so, you know, recognizing that there were some opportunities perhaps to, you know, make some adjustments, to test out some different ways that they're communicating, looking at ways to do things a little differently so that we can truly say mutual aid is only used when absolutely necessary for really more of those true emergencies, multi-casualty response, or some form of disaster, if you will, which we hope doesn't happen in our community. But when those circumstances occur, that mutual aid is mostly reserved for those and very limited use any other time.
Who makes the decision on mutual aid then? Is it a team decision, or is there someone that says we need help?
Well, I think it can come in different forms.
Right.
I think, you know, the chief in a fire situation, his staff can ask for mutual aid. When they get on scene, they know, and they may see that, hey, we're going to need more people here, and it's more than our department can handle. Or it could be a dispatcher through the situation and call may determine through the information that they're receiving that, or managing the resources, that they're going to have to go to a mutual aid request to an outside agency.
And mutual aid works both ways too. It's not just Sioux Falls getting resources, but we take our resources out to communities. If there is a local town that needs help because they're overwhelmed, it's a mutual agreement. So we'll go there too. And we do that on a regular basis, go to some of the smaller towns to help their fire service.
I think what's fascinating right now is that you're all working together in a pilot project to take a look at all of this, and you do this quite often. Mm-hmm. Jill, let's start with you. You know, what is the pilot project? What's involved with this, and what are you analyzing?
Well, I think what I can start off by saying is that, you know, I alluded to this just in my previous comments, that we, you know, as this group got through about a year's worth of a really major transition to a new ambulance service, and a very new way of doing things as a system, because they brought in new technology, they brought in new leadership, they brought in just a new way to really manage an ambulance service to a higher level than we've seen before. But that took an incredible amount of then transition on everyone's part and really learning how to work together as a system. And so after, about a year's worth of really getting that transition through, there were times when we saw that there might be some opportunity to do, look at a few times when we've perhaps seen that maybe we could respond in an even better fashion to certain calls. So, I even said to the council back in July of 2016 here, that when we were presenting to the council that we really, the system is working incredibly well, but there are some things that I think we should be doing some performance improvement on. But not to mistake that for the performance of each of the segments of the system, because each of these folks have been doing exactly what they've set out to do. They're all meeting their individual compliance. Paramedics Plus is meeting their contract compliance in every case since they started. And so, but there's always opportunity to improve. And in health systems, that is the norm, is to engage in performance improvement, quality improvement. So I, defer now to these guys to really talk about the nuts and bolts of that in a little bit more
Sure.
detail.
How does this pilot project connect with each of you and what you do? Let's start with you, Paul.
Well, a lot of what we've taken is through the fire department and Paramedics Plus is to take the information, how they want us to manage the resources. And I think that's the best way to put it for us is the recommendations that we've taken. And it really comes down to how Metro can best manage the resources at the request of our end users here, which are the fire department and Paramedics Plus. So we could efficiently, as Jill put it, to manage what we have and ultimately serve the citizens who we're here to serve, and that's what we're doing. But again, it's kind of the information that we've gotten from the fire chief and Paramedics Plus, and how we're going to manage and get those resources out to the scene.
Mike, what's your part of it?
For Paramedics Plus, this is really about leveraging the technology that was here already. We brought in a lot of technology, and it took a year to kind of merge those two technologies together to see what bubbled to the top as a best practice. And for us, the pilot concentrates on using some of the technologies provided by Metro Communications to allow us to make better decisions and give better responses. That's really where it's at for us, and to really give us an ability to track data better and to make improvements going forward. We can all feel that we're going in the right direction, but having an ability to actually see some data that drives us in a direction is ultimately the best for the citizens.
And for Sioux Falls Fire Rescue, Chief?
Well, it's the same thing. What we do is we know we can get there and say, here's what's going on, and then essentially the control center of this whole operation is Metro. It's like an airport. They're essentially the control tower. We'll get there and say, here's what we need, and then they can get those resources because they know everything that's going on in the city. We have 11 fire stations, but we could have all those people tied up and not realize it, just like we could have the ambulance tied up. It works great to look at this pilot program and say, okay, they know where everything's at, and they can manage those resources. And as Jill alluded to, pilot programs are being done all the time. If you're not doing pilot programs, you're not a high-performing system. Years ago, we did a pilot program looking at our public access defibs, and we did 10 of them. And we found out they could save lives, and now we have, in Sioux Falls, we have over 1,400. That was based on a pilot program just like this is. So we're always looking at best practices, what's the gold standard, and then moving to that and say, this is helping us. So it's key to look at, if you're not looking at improvement, you're stagnant, and we want to provide the best level of service to the community.
And Jill, I would assume that things are always changing, so how do you know how to respond unless you do things like pilot projects?
Yeah, absolutely. And it really falls under that whole, model of performance improvement. And, it's one of the things that was exciting about Paramedics Plus coming on board is because, in their request or their proposal that they presented to us when they were bidding for this contract, they talked about, performance improvement and quality improvement and what they've done in other communities. And so I said, okay, let's apply that here. We do that all the time in our, like at Falls Community Health, for example, and let's apply that to the EMS system. And they've done a fantastic job of really looking at what's been alluded to already. They look at the data, so you have factual information that everybody can say, we agree that this data is what we want to be improving upon. And then saying, okay, what are some changes that we can make? What are some adjustments? What is some fine tuning? And then let's measure it again and see if we've actually seen improvement. And if we have seen improvement, then we can now say, okay, our work is good. We can now apply this as the standard of how we're going to work and operate in this particular space of what we do every day. So.
And I think I could dive in a little further here. So I can give you another example. So we talked about the heat maps earlier. So we used it to originally set up our posts. What we discovered is there was a small portion of service of the city that was getting great service, but we suspected they could get slightly better service. So we were already having amazing compliance in that area, but we thought we could improve it. So we looked at just moving one of those ambulance locations just a couple miles, just a mile or two down the road for just a month to see what happened. And sure enough, having better access to better streets to get into that corridor, into that community, improved, and we saw better responses. So we do these things all the time. That came from no prompting other than us looking at it daily, going through every single call or not compliant, and looking at it and going, where can we improve? And there's an example of one.
So you don't wait for a pilot project. It's a fluid process for all of you.
You know, the other thing too, Reed, is that really with this team that's developed, the Eagles are kind of checked at the door. So there's not a worry that we're going to be pushed aside or they're going to be pushed aside. It's more like what's the best interest of the patient than our organizations. We're working together as a team, and I think that's one thing that's worked really well that has been evolving. We just get together just like this and say, hey, we'll have coffee and talk about what's going on for our teams, and then bring the teams together, and it's worked really well.
Mm-hmm.
Let's talk about the contract, because it's been a number of years since Sioux Falls has changed EMS ambulance providers. So what does your organization do, Jill, to monitor the contract compliance and performance with Mike's team?
Well, it's an extensive amount of work, actually, to monitor compliance, because they're held to a number of specific measurements and indicators that whether it be timeliness of performance through response times, quality of care, adherence to protocols that are required of them and are approved for them. And so Julie Charbonneau, I'll give a shout out to her because she is the one who does a lot of that quality assurance work. And then Dr. Jeff Luther is our EMS medical director, and he also is, reviewing, he's approving, he's making recommendations to the medical board and to REMSA. And the two of them really work very well together to make sure that the system is performing as it should be. But one of the primary responsibilities she has is contract compliance. It's making sure that franchise agreement, that exclusive franchise agreement that's been that Paramedics Plus has, that they're meeting that. But the beauty of it is they're doing that work without any subsidy provided to them. They're able to perform and operate at a high level so that they can be as efficient as possible and as effective as possible, bill for those services, be reimbursed for those services, and be able to do so without any subsidy. And I think we are really fortunate in our community that we are at that point, because we may not always be there. It may not always be the case as our community change, as payer mix, getting a little farther in the weeds here, but as those kinds of things change, that may not always be the case 10, 20, 30 years from now. So we have to take full advantage, if you will, of this fine system and organization that these folks have worked together on to make sure that our services are as high functioning as possible.
No subsidies. Is that a unique situation for your company?
Generally, we don't work in contracts that involve subsidy, but subsidy is very common. That's really a community decision that has to be made, and that's based on what the needs of citizens are and what services they want provided. It just so happens that the City of Sioux Falls at this point in time is, put out an RFP that allows for an exclusive franchise, and that exclusive franchise allows us to operate without it, without any type of subsidy. But it is common in some communities. Not very many of our contracts rely on subsidies, but they're generally public utility models or franchise models being the two that we see most often. But it is common.
Yeah, and Jill, as you mentioned, it's a very fortunate position to be in here.
Absolutely. We get a great level of service, and we have a great partner between the agencies and departments, and I think it's a win-win for our community.
In closing, from service, from a citizen's perspective, from especially the three of you, and please add on because you're running a health clinic and all kinds of great services with the public health department. So we as citizens now, when we want and have some issues that we're calling, there's always a reticence. When should I call 911? When shouldn't I? Is it bad enough for me to call for help or not? Let's start off with you at Metro. What do you tell people that ask that
Well, I
question?
think you have to use common sense, and we always encourage people to call 911 and not to be afraid to use 911, because that starts this whole systems approach. And the sooner that phone call is made, the sooner that we can get help. And part of it is we can assess that phone calls that comes in through what I talked about, that triage of questions, so we can determine at what level we can dispatch. So we just encourage people to use it. That's what the system's for, and we really encourage people to use it. And we get a lot of phone calls. I mean, we get approximately 13,000 medical calls a year, and that's something that we constantly have our own quality assurance coordinator. That's his job, is to go back and look at those calls and determine how we did and our times to make sure that we're dispatching in accordance to our accreditation, and something that we're proud of and what we meet. But really, bottom line is, that's what 911 is for, and we encourage people to use it when it's needed, and so we can get these people out here to the scene and take care of the people as fast as we can.
Mike from Paramedics Plus, oftentimes it's our first experience with an ambulance or an EMS type situation. What words do you have to encourage us in asking for help, and then how to interact with your crews when they come?
Absolutely. First of all, people should go ahead and engage the EMS system. We have a system here. That system is here to protect the citizens and to support them, and they should actively engage in using it when they think it's necessary. I wouldn't discourage anyone at any time to avoid calling 911. We have call triaging in place. Once we get there, we're able to assess not only as first responders, but also in advanced life support and transport. So I would go ahead and encourage people to go ahead and use that system. Once we arrive, the important thing to do is to make sure that you're clear with what your need is and why you've called and what we can do for you at that moment. It's often difficult for people to understand that that's their moment of emergency. It's not our moment of emergency. We try to be very sensitive to realize that you're experiencing an emergency at this moment, but we go from emergency to emergency. So what we need is them to explain exactly what resources they need used so that we can quickly apply those and get them to the place where they need to be.
And Jim Sideras, Sioux Falls Fire Rescue, is often there as well.
Yes, I agree. Call early. Fires go from little to big very quickly. Our biggest enemy, and I think both of our biggest enemies, is time. We're always behind the power curve, regardless if it's EMS or fire, so it doesn't hurt to call. We get called all the time. We'd rather go and not need all our services and find that out than to get there too late, because we can't turn back the time. And the other thing to think about is we're here to help the community. The community is paying for us, so we're ready to roll whenever they need us. And if they feel that they need our help, by all means call, and it'll be triaged and the appropriate services will show up.
Well, thanks for helping us understand what we need to do to help make your jobs easier too. Last question, Jill. What's the future hold for the EMS system as you're planning it?
Well, I think the future holds continued emphasis on leadership within the EMS system, staying abreast of what is happening, in other communities, what's happening across the nation, what are the needs of our community, how can this team work as a system to meet the needs of the community, and making sure that we have the resources in place to do the work that we need to keep our community safe and as healthy as possible, and when they need that emergency assistance, that they have it when they need it to improve their outcomes as much as possible.
All right. Thanks for the conversation. We
Thank
appreciate
you.
it very much. If you want to find out more about our EMS system, just go to our website at siouxfalls.org. It's where you can find the Public Health Department and Sioux Falls Fire Rescue. And also Metro 911 is on the web at 911metro.org. Paramedics Plus is at paramedicsplus.com. And watch soon on siouxfalls.org for frequently asked questions on your EMS system here in the city of Sioux Falls. I'm Reed Holson. Thank you for watching Sioux Falls Directions.